Hi everybody, I'm so glad that you have found your way to this video. This is the start of the Closer Look Project Referral Network Training Program video, which accompanies the book that I wrote, which is basically the manual to get you through joining this referral network program. The education is free. However, for you to use the program, you will have to visit our website and purchase the program itself. And then you'll be able to use all the benefits that are associated with the program. So welcome. We are going to get into chapter 1 today. There are 7 chapters, and this week we will cover chapter 1. So chapter 1 is entitled The Why Behind Closer Look. So the agenda for tonight, we have the introduction, why personal care professionals, data and statistics, risk factors and prevention, and finally some tips and takeaways. So these are the objectives for the program. Learners will be able to discuss modifiable risk factors associated with the development of skin cancer. Learners will have the knowledge of statistics related to skin cancer prevention and early detection. Personal care professionals will know the difference between primary, secondary, and tertiary prevention as it relates to skin cancer. And upon completion of Module 1, learners will have a greater understanding of the Closer Look project and its foundation. I hope that these objectives are attainable for you, and I would love to have your feedback upon completion of each chapter. Introduction. Who are we? Who am I? What is the Closer Look project? That's kind of why we're here to get into. So, who is James Caleb Runyon? I am Caleb Runyon, a 28-year-old man from Logan, West Virginia. I am a master's prepared nurse practitioner with a focus in family medicine. I began my healthcare career in 2018 when I graduated from a surgical technology program and began working in the operating room, which I loved. Shortly after, I decided to pursue nursing school, which had always been kind of my goal. I graduated from nursing school in 2021, and I began working in the emergency room. So after gaining experience in the ER, I realized that my dream of becoming a provider was still kind of strong and persistent in the back of my mind, and so I pursued NP school. So for my professional career, I graduated in 2024 as a nurse practitioner, and I began working in dermatology. So after working in dermatology for a little over a year, I wanted to branch out and develop a more internal medicine / acute care skill. So I began an acute care surgery fellowship where I cross-train in trauma, emergency general surgery, and surgical ICU. So I also work 2 days a week in the free clinic where I offer dermatologic services as well. So I'm a strong advocate for health equity and inclusion, public health, and human rights as a whole. Personal life, I do have a partner whose privacy I try to respect online. I have a 5-year-old Great Pyrenees named Amelie, and she's the best girl ever. And I love spending time with my family, and that includes my papa, my mom, my sister, and brother, and my niece, Ava. And I will have a second niece in like a week or so, which is crazy. I enjoy traveling, singing, hiking, and learning about other cultures as well. So, formation of the Closer Look Project, or CLP. Why was CLP established? So, plain and simple, it was founded because early skin cancer detection saves lives. We all know that, that's common sense, but there's a bit more to it than that. In my dermatology practice, I had heard over and over and over again, my hairdresser noticed this spot on my scalp. What do you think about it? And guess what? 8 out of 10 times it was cancer, whether that was basal cell carcinoma, squamous cell carcinoma, or melanoma, or even precancerous lesions. It was happening. And it wasn't really news to me or a shock to me that hairdressers could have this capability because my mom is a hairdresser and business owner and has been for over 25 years. So there were many times growing up that I would hear her talking about Betty or Susan came in and had this growth on their scalp, and just I knew that was happening. But I let the realization and that kind of understanding just kind of hang out in my brain. I didn't do anything about it. But in February of 2025, my papa was diagnosed with stage 4 melanoma. It had metastasized, which means grown or spread, to multiple lymph nodes, a portion of his small bowel, and his bone. So at that time, I felt really sad, angry, confused, helpless, and I decided to do something. But I wasn't sure what it was that I would do, but it was going to be something. And so you could say that the Closer Look project was started because of him, my papa. And in these photos here, don't worry, he is not angry. He just always mean mugs in photos and selfies because he does not like pictures. So he's all good there. So what? Initially, I called this project the Hairdresser Dermatologic Detection Initiative, or HDDI. It's a mouthful. It was a survey with hopes of becoming a study or a publication, and my goal was to establish sort of a pilot study which would establish a baseline understanding, um, or it actually determined the baseline of understanding and education that hairdressers had when it comes to recognizing abnormal lesions on their client's skin. So the initiative itself gained local traction and was featured on the local news, and I started to get feedback and questions. What about me? That was the question. That was the big question that I started to get. Suddenly, tattoo artists and fashion designers and personnel and nail techs started asking me, like, what about me? What about our profession? They see a lot of clients up close and personal as well. And so I started to think about it, and I decided, you know what? They are right. Let's include everyone, anyone and everyone that can be utilized in this program. And so we called it the Closer Look Project. It was born to include all personal care professionals, nurses, and anyone who can support our mission. So, what exactly is the Closer Look Project, though? It is a lot of things. It's a consulting company, it's a public health advocacy company. We educate community, personal care professionals, and healthcare professionals. We also provide support to cancer survivors, their families and friends, as well as cancer um, patients who are dealing with cancer acutely. And most importantly, we have a referral network program which partners personal care professionals with healthcare clinics in various locations. So at present, we have 2 partnering clinics in West Virginia, 2 in Virginia, 1 in Arizona, and we are in talks with some from Ohio and North Carolina. So I'm super excited about the growth that we're gaining and in only a few short months. When? So the initiative started up in March 2025. The Closer Look Project became an official LLC, or limited liability company, in August 2025. And how? How am I qualified to do this? How does it work? The how is multifactorial, and it works because people at their core want to help other people. And so whether that is community, physicians, nurse practitioners, physician associates, hairdressers, tattoo artists, estheticians, or anyone else, people like to support their people, their community. And that is my goal. It works because you guys work. Our team is small, but it is mighty. And as we progress through these 7 chapters over the next couple weeks, you will see more and more about the intricacies that is the Closer Look project. And I invite you to stay for the ride, and I hope you enjoy it. So, why personal care professionals? I say, why not? So, to answer the question of why personal care professionals are included, we have to first understand what they are. So, the Bureau of Labor Statistics states that personal care professionals include barbers, stylists, cosmetologists, fitness trainers, manicurists, pedicurists, and skincare specialists. And I included down here that nail techs and estheticians, massage therapists, tattoo artists, fashion designers, and personnel, all of these people play a very important role. And so that is who these people are. Why? It is a growing field, and they are prevalent in our life. So think about it. How often do you visit your hairdresser? How often do you get a massage? How often are you getting your nails done? For me, I'm getting a haircut every 2 to 4 weeks. I get a massage every couple of months. Well, when I can afford it. And so the average person, though, at least manages a haircut for the most part, right? So on average, women see a hairstylist every 4 to 6 weeks, and men visit a barber every 2 to 4 weeks. Many of us only see a dermatology provider once a year, maybe more, but mostly less. And that makes personal care professionals a vital resource for early detection and education. So that is why personal care professionals. So moving on to some skin cancer data. So did you know that skin cancer is incredibly common, with 1 in 5 Americans developing skin cancer by the age of 70, which is pretty early. Skin cancer kills, with more than 2 people dying every hour in the US from invasive skin cancer. When you sustain 5 or more sunburns, this doubles your melanoma risk. And early detection will give you a 99% 5-year survival rate for melanoma, which means that if you diagnose melanoma early enough, then your survival time will be 5 years at least. But for many of us who diagnose at the early stages, it can be much longer than that. Diversity in dermatology, that's a big topic. Black and brown patients are often overlooked when it comes to the conversation of skin cancer. Why is that? So, a misconception is that melanated skin does not burn, that they're immune to sunburns, but that's not the truth. Melanated skin often um, does burn, and it only provides a base SPF of around 13, which is pretty low. Higher mortality. Black and brown patients have a higher mortality from melanoma, typically because it is found much later and in areas like the palms, soles, or under the nails, which are discrete areas. My goal here is not only to teach you about white skin, but all skin types, and then discrimination. Whether you know it or not, it is very much alive in healthcare today. And you may love black people, you may have a best friend who is Hispanic, you may love your Asian coworkers, but we always have to assess ourselves and make sure there are no preconceived notions or learned behaviors toward those with different skins than us. So that is internal work, and it is hard work, but it is worth it. And we support all backgrounds, ethnicities, and races. We take a closer look at all skin. Risk factors. What are risk factors? So we have modifiable risk factors, which are things that you can change or prevent to decrease or increase your risk of skin cancer development. And then non-modifiable risk factors. Those are things that you cannot change, they increase your risk, and there's nothing we can do about it. So let's play a game. I will show you an image of an activity or behavior, and you determine if it is a modifiable risk factor or non-modifiable. I'll give you a few seconds after each image, and then we'll talk about the answer. So sorry about this. Let's play a game. Tanning or tanning beds. Is this a modifiable risk factor or a non-modifiable risk factor? So this is a modifiable risk factor, meaning you were not born with a tanning bed as your bed at night, and so you aren't forced to tan, and so this is modifiable. You can change this, and that can decrease your risk. Family history of melanoma, your DNA, your genetics, is that modifiable or non-modifiable as a risk factor? This is a non-modifiable risk factor. There's nothing you can do about your DNA. Now, another conversation is like CRISPR and changing your DNA and or changing the DNA of your unborn baby. Like that's another conversation. But at present, you cannot change this. Okay. Red hair, pale skin, or a phototype, skin phototype of like one. So this is a non-modifiable risk factor. If you're born with pale skin, you have blue eyes and red hair, you have a significantly higher risk for burning and melanoma development and skin cancers. How about occupation? Modifiable or non-modifiable risk factor? So this is a tricky question. Farming or working outdoors significantly increases your risk. So your occupation can be a modifiable risk factor, but in some regions, in rural areas, farm work and outdoor work is the only source of income. So it may actually be a non-modifiable risk factor for many people. So I think you get the idea about modifiable and non-modifiable risk factors. So modifiable risk factors include UV exposure, whether that's by tanning or photo exposure or laying in a tanning bed, whatever, your lifestyle, sometimes your occupation, and lack of sunscreen use. Non-modifiable risk factors include your genetic predispositions or DNA, your family history, your skin phototype, age, sex, race, or ethnicity. So we have now discussed risk factors. Now we move into levels of prevention and how we can proactively reduce those risk factors that we talked about. So I'll spare you the game this time, but just think about your answers and see if you have a good grasp or understanding of these levels of prevention. So primary prevention. What are some examples of primary prevention? So primary prevention is something that you do to prevent the disease before it ever even thinks about getting started. So relative to skin cancer, we can apply sunscreen, UPF clothing, SPF chapstick, wide brim hats, seeking shade when outdoors, and educating ourselves. Those are simple ways to prevent skin cancer from developing, and that is primary prevention. Secondary prevention. So this is the detection or the treatment of a disease early on or eliminating behaviors that place you at higher risk. It's basically when you realize the damage has been done and you begin making an effort now because it's better late than never, right? So for example, myself personally, I was not super keen on wearing sunscreen for a very long time, and I probably started wearing sunscreen consistently when I was 25 years old. I'm 28 now. And so that, in my opinion, would be a secondary level of prevention because yes, there's damage that's been done. Yes, I'll probably have some concerning spots later in life, but I'm doing the work now to make sure that I prevent disease later. And so, common examples include screenings like your skin exams and treating early precancerous lesions. Those are examples of secondary prevention. And finally, tertiary prevention. So what would you think could be some examples of tertiary prevention? So you see the elderly family member is laying on the bed, someone's comforting them. So tertiary prevention is managing an established disease, such as treating someone with advanced melanoma with like chemotherapy, immunotherapy, or radiation. It's pretty much damage control. And so hospice or palliative care, those can be examples of tertiary prevention as well by improving your quality of life and managing the state that the patient may be in. So this is the last slide. These are some takeaways. So importantly, personal care professionals are very, very present in our lives, right? You see one of these people at least once a month, at least once a month. And so they're super important to this cause. Skin cancer is common, but it's highly survivable if detected early. Next, disparities do exist, so it's so important to provide inclusive education for yourself and for others as well, and always take inventory of the way that you think about a certain situation or a person or a condition, and it's never too late to educate yourself and to become better, right? So finally, prevention and early detection save lives. So I always say this, it's not just about prevention, it's not just about early detection, it's also about connection. And the Closer Look Project creates that piece that's been missing for so long. And so, you find a skin cancer, a hairdresser knows it's a skin cancer, and then you tell the client, well, then what? We have to connect these clients with clinics, we have to connect them with resources, we have to connect them with someone who can keep them accountable and make sure that their health is taken care of. So thank you so much for attending this educational lecture, and that was chapter 1 of the Closer Look Learning Program. Please, I encourage you to ask questions, make comments. If you would like to ask me a question, my email is there. You can also check out our website at www.closerlookproject.com, and I look forward to seeing you in the next video lecture. Bye.